Hi and welcome back to another video of Medic Notes. This video is on intracranial hemorrhage. Intracranial hemorrhages can be divided into two main types: extracerebral, occurring in relation to the coverings of the brain, and intracerebral, occurring within the brain. Extracerebral intracranial hemorrhage may be divided into different types, according to the anatomical space in which it occurs in relation to the meninges, extradural, subdural, and subarachnoid. First, for extradural hemorrhage, it is bleeding into the extradural space between skull and dura. It is usually caused by trauma to the skull associated with a fracture tearing an artery or dural venous sinus. It is particularly common with fractures of the temporal bone tearing the middle meningeal artery. Hematoma develops outside the dura, causing compression of the underlying brain, resulting in transtentorial herniation. It is commonly fatal unless diagnosed early and treated by surgical evacuation. The clinical features of extradural hemorrhage include temporary concussion, recovery or also called as lucid interval, decreased conscious level, coma, falling pulse rate, rising BP, dilated ipsilateral pupil, contralateral hemiparesis, focal fits, and maybe boggy swelling overlying the site of fracture as extradural blood tracks through the fracture into the subcutaneous tissues. Next, the second type is subdural hemorrhage. This is bleeding into the subdural space between dura and arachnoid, caused by bleeding from veins which cross the subdural space. Subdural hemorrhage can be divided into acute subdural hemorrhage, seen following head injury caused by falls or assaults, or chronic subdural hemorrhage, usually seen in the elderly, where brain shrinkage makes the bridging veins between cortex and venous sinuses vulnerable. This may result from trivial and forgotten head injury. Hematoma appears as a layer of gelatinous blood in acute type, or an organized layer of granulation tissue and clot in chronic type. Compression of underlying brain causes decline in conscious level. The third type of extracerebral hemorrhage is subarachnoid hemorrhage. This is bleeding into the subarachnoid space, which is between arachnoid and pia. Its causes include traumatic in association with head injury, spontaneous, due to rupture of Barry aneurysm, rupture of vascular malformation, or rupture of intracerebral hematoma into subarachnoid space. Pathologically, there is a layer of blood over the cerebral surface in the subarachnoid space. Blood present in CSF usually presents with headache and signs of meningeal irritation. 60% of cases die immediately. 1/3 of survivors are permanently disabled as a consequence of hypoxic brain damage. Hydrocephalus can occur in survivors where fibrous obliteration of the subarachnoid space or arachnoid granulations may occur. Next, moving on to intracerebral hemorrhage. This is an expansile hematoma within the brain substance. Causes include hypertensive vascular disease, which is the most common cause, trauma, bleeding into a tumor, vascular malformation, cerebral vasculitis, and associated with coagulopathies. The commonest sites for intracerebral hematoma include basal ganglia, internal capsule, thalamus, cerebellum, and pons. Diffuse petechial hemorrhages are small pinpoint hemorrhages scattered throughout brain. This results from disruption of wall of small cerebral blood vessels. The causes include vasculitis, acute hypertensive encephalopathy, fat embolism, and head injury. That's all for this video. Thank you.